My name is Diane Wilcox. I'm a nurse practitioner and I care for patients with COPD. The following module will discuss key recommendations for keeping people with COPD healthy and out of the hospital. It's important when teaching patients that you follow guidelines. Make sure what you teach your patient is consistent with your patient's prescribed plan of care. Make sure you comply with your state licensure, regulations, and scope of practice. COPD is a complex disease. It's often accompanied by other systematic effects, including weight loss, poor nutrition, muscle loss, and muscle dysfunction, all of which contribute to a decrease in exercise ability. People with COPD often have other comorbidities. This is probably due to the fact that patients with COPD often smoked a long time and were diagnosed in middle age. And they have other common chronic diseases, such as cardiovascular disease, osteoporosis, depression, and lung cancer. Comorbidities influence both mortality and hospitalizations. It's important that people with COPD receive simple instructions to help manage their disease. The following recommendations will help you teach your patients how to manage their COPD, stay healthy, and out of the hospital. They include smoking cessation, symptom management and action planning, medication adherence, medical appointment adherence, exercise and activity, and then finally, healthy living recommendations.
Prior to that, it was at least 2-3 times a year what they call an exasperation, where it's a medical term for a lung infection. So I live in fear of ending up in a hospital, so that's why it's become my job. My job is to keep myself healthy and out of the hospital.
Step 1, smoking cessation. Smoking is the leading cause of COPD. Smoking harms the entire body, but especially the lungs. Smoking makes COPD symptoms worse and leads to frequent hospitalizations. It's estimated that 8 out of 10 COPD-related deaths are caused by smoking. As we age, our lung function declines, but never makes us short of breath. The blue line on this graph represents a never smoker. Smoking, however, hastens the decline of lung function and leads to disability as well as a shortened life expectancy. The red line represents someone who smokes. Quitting at age 50 means less of a decline in lung function, prevents disability, and extends life. Quitting when you reach disability or develop symptoms of shortness of breath can still extend your life. Quitting is the most important thing someone with COPD can do. It improves both their symptoms of COPD, slows the progression of COPD, and extends their life expectancy. Patients should live in a smoke-free environment and avoid secondhand smoke.
I was a smoker for 45 years, and even knowing how bad it was for me, I was very dependent upon it. It wasn't easy. It was the hardest thing I've ever done in my life. And for me, who truly felt that I must be so addicted to cigarettes that I could not quit, I did.
Quitting smoking is difficult. It's important that you encourage your patients to quit. Provide them with resources to help them quit, including counseling and medications. Check both state and national resources. Motivational interviewing techniques can be used to help your patients quit. Refer to the module on motivational interviewing for more information. Step 2, symptom management and action planning. Patients who know their symptoms and have an action plan can avoid hospitalizations. It's important to teach patients about the symptoms of COPD. They need to recognize symptoms of everyday symptoms as well as acute symptoms. As we've discussed previously, COPD includes symptoms of cough, mucus production, and exertional dyspnea. These are symptoms that can be present every day. Acute symptom changes, such as a difficulty completing activities of daily living, require action. It's important to educate patients about action planning. Action planning includes steps patients take to stay well and help manage their symptoms and keep them out of the hospital. The Zones to Manage COPD is a tool to help you teach your patients symptom recognition and action planning. The tool includes everyday medications as well as rescue medications. There are 3 zones to describe the type of breathing day the patient is having and an action to take for each zone.
Well, I keep that chart in my bedroom, and it's in that little top drawer with the rest of my medications. And it reminds me that, when I'm having my good days, which are the green, maybe the beginning of maybe a not so good day with the yellow. Well, I definitely don't want to go to the red, I don't want it to even get to that point.
The green zone. The patient feels well and is breathing easily, able to do their everyday activities without distress. This is the zone the patient wants to be in. When you educate your patients, focus on continued use of everyday COPD medications and encourage participation in some form of exercise. This is also an excellent time to review inhaler technique with your patients. The yellow zone. It's a warning. This zone means there are changes in how the patient feels. For example, the patient may have increased difficulty with breathing, increased coughing with mucus production, a change in the color or quantity of their mucus, or they may also have wheezing and chest tightness. What to do? The patient should continue their everyday medications, use rescue medications, and they must call their doctor or nurse for further instructions. When you educate your patients, these are the symptoms that patients tend to minimize. If your patient is in the yellow zone, they are having an exacerbation. Discuss importance of contacting healthcare team rather than later in order to prevent hospitalization or readmission. Early identification and treatment of a patient in the yellow zone could prevent a hospitalization or readmission. What is an exacerbation? It's an acute event characterized by a change in a patient's symptoms and baseline functioning. It may warrant changes in their regular medication regimen. Exacerbations are the leading cause of hospitalization in patients with COPD. The red zone. This is an emergency, and the patient is having an acute exacerbation. They need emergency care. Patients in the red zone describe a very bad breathing day. When educating your patients about the zones, the emergency zone is when they need to seek immediate medical care. The goal is always to prevent a patient from getting to the red zone. When teaching patients, don't assume anything. Start with the basics. When teaching the zones, think about, can they read? Is it in their preferred language? Is the print large enough for them to see? And do they understand their action plan? Use techniques such as teach back to assess their understanding. COPD is chronic, but there are triggers which can make the symptoms of COPD worse. These include respiratory infections, stress and anxiety, smoke, pollution, changes in temperature or humidity, strong perfumes, odors, even air fresheners. And lastly, not taking medications correctly or as prescribed. Infections are the most common trigger for an exacerbation. Educate patients how to avoid infections, including frequent hand washing, keeping their hands away from their face, encouraging both pneumococcal vaccination and influenza vaccination. Step 3, medication adherence. Lack of medication adherence is the leading cause of hospitalizations and readmissions. Of all medication-related hospital admissions in the United States, up to 70% are due to poor medication adherence, and this is quite costly. Medications for COPD include inhalers, nebulizer, oral medications such as steroids, antibiotics, anti-anxiety medications, antidepressants, and oxygen. What is an inhaler? It's a portable device. It's used to administer inhaled medication or medication the patient breathes in. An inhaler can be either their everyday inhaler or their rescue inhaler. Everyday inhalers should be used every day, even when the patient is in the green zone. Rescue inhalers should be used when sudden symptoms present themselves or when the patient has a hard time breathing. Patients need education on inhaler technique. Use of the inhaler medications prevent exacerbations and hospitalizations. 80% of COPD patients do not know how to use their inhalers correctly, which can lead to hospitalization.
With the inhalers, they can be kind of mysterious, I think, because we frequently, some you're supposed to breathe deeply, others you're supposed to, use with a spacer, and others you don't use. So it gets confusing, and I think sometimes overwhelming to people. There's a lot to learn.
There are troubles, however, with inhalers. There are many different types, and every one has a different technique. Lack of instruction by healthcare team on inhaler technique is trouble. Frequently, it leads to incorrect use of the inhaler. Patients need education on correct use of their inhaler devices. Use of the teach-back method is an effective way to assess your patient's understanding of inhaler use. Drug manufacturers often have demonstrations on inhaler techniques on their websites. A nebulizer. This is a device used to deliver different types of inhaler medications, but they can include the everyday medications as well as rescue medications. It can be used with both chronic and acute COPD symptoms, and it can be used in any healthcare setting as well as in the home. Again, it's important that your patient understand how to use the nebulizer. Respiratory therapist or a nurse can help. Oral medications such as antibiotics or steroids are prescribed during exacerbation. Often, corticosteroids or prednisone are prescribed in a tapering fashion, from a large dose down to a smaller dose. It's important that your patient understand how to take their medication. Again, use of the teach-back method can help to assess your patient's understanding. Oxygen is a medication, and it requires a prescription. Patients should not change their oxygen levels without speaking to their provider. Portable tanks are available and allow your patients to leave the home with an oxygen supply. Portable oxygen requires a prescription as well. Educate your patients about smoking safety, such as no smoking or having oxygen near an open flame, such as a candle. It's important to teach your patients to take their medications even when they feel well. Patients who take their medications as prescribed feel better and spend less time in the hospital. Helping patients to adhere to their medications. Review medications with your patients. Ask them if they know how to take their medications. Do they know when to take their medications? Ask them to tell you how they take their medications. Can patients afford their medications? How do they get their medications from the pharmacy? Do they know how to refill their medications? And do they know who to call if there's a problem with their medication or a side effect? Use of the teach-back method can help to assure understanding of inhaler technique, as well as when and how to take their medications. Stress the importance of not running out of a medication. If this occurs, they should call their doctor or nurse immediately.
I think you sometimes need to be shown more than once or twice, because I found that out with a lot of things related to COPD and the things that we use to help ourselves get over things.
For some patients, consider a pharmacist evaluation, especially when there are several comorbidities or this is a new COPD diagnosis. Also, social work evaluation can be helpful, especially if you identify inadequate caregiver support or financial support. It's important to remind patients that medications change often, especially when there are several different providers. Patients must keep track of medication changes, including dose changes, for their own safety. Provide patients with tools to keep track of their medications, such as a medication wallet card. Encourage patients to keep an up-to-date list of their medications. Share this list with all members of their healthcare team. Bring the list to all appointments as well as to the emergency department. And it's also helpful to bring medications to provider visits. Step 4, medical appointment compliance. Follow-up visits are important. Timely provider follow-up after hospitalization or an emergency room visit is critical to maintain their health. Follow-up appointments help patients stay well and out of the hospital. Patients should keep their follow-up appointments even when they feel well, but especially when they feel poorly.
Well, you know what? I never miss my appointments. Oh, not my pulmonary appointment, because that's the one that keeps me breathing. But even if I felt good, and I know in the back of your mind you might say, "Oh, I feel good. I'm not going to go to that doctor on that doctor's visit." But I would strongly suggest that to go, whether you're feeling good or not, because you're going to learn something. Every time I go to my CU doctor, I always learn something new, and so I enjoy going to come in.
When preparing a patient for discharge from the hospital, schedule your patient's follow-up appointments before leaving the hospital or other care facility. Make sure that the appointment is the best day and time for your patient, and ensure that they have transportation. Remind patients to bring all medications or medication lists to all appointments, including any over-the-counter medications. It's important that patients bring family members, if available, to their appointments. And encourage patients to bring a list of questions to ask their provider. Exercise and activity. Step 5. Specific activity level must be determined by the patient's healthcare team, but exercise is generally safe and beneficial for the patient with COPD. Exercise is actually quite important in keeping them healthy. This is a list of sample activities, but in addition, a referral to pulmonary rehab is also recommended for many patients with COPD to help maintain their health.
I do try to get as much exercise as I can, and I do walk. I realize, what I really do is I walk in place. Sometimes the weather doesn't permit to go outside, but I walk in place for about 20, 30 minutes if I can get up to that speed.
Pulmonary rehabilitation is a structured exercise program that includes patient education on COPD and self-management. It's supervised exercise. There's education about their medications and oxygen use, nutrition counseling, ways to conserve energy, psychological counseling, as well as group support, and education on breathing techniques. For additional information about pulmonary rehab, please watch the pulmonary rehab module. Breathing techniques can help to reduce and control the degree of dyspnea a patient may experience. For everyday breathing, there's pursed lip breathing or diaphragmatic breathing. And then when a patient is experiencing increased shortness of breath, there's rescue breathing techniques.
The pursed lip breathing, where you breathe in through your nose and out through your mouth, you catch yourself before you start panicking and going, it helps a lot.
The following will demonstrate pursed lip and rescue breathing techniques.
Pursed lip breathing is very important for people with lung disease. It helps get the air out of your lungs. You want to breathe in and blow out 4 times as long as you breathe in. The best way to do it is to be in a chair with a back or your back supported in bed or with pillows at night. The more you repeat it, the more you practice, the better you'll be at it. You want to breathe in through your nose and blow out through pursed lips, 3 to 4 times longer than you breathe in. You're going to use your diaphragm, which is the most important muscle for breathing. Put your hands on your belly. Breathe in through your nose, blow out through pursed lips. As you breathe in, your belly should rise. And as you exhale, your belly should fall. You don't want to use your upper body and your shoulders, but you want to work on the belly breathing, the diaphragmatic breathing. Pursed lip breathing should be used all the time, including during exercise. Rescue breathing can be used for times when you're short of breath or when you're doing an activity that makes you short of breath. The purpose of rescue breathing is to elongate your chest, have your belly drop out of the way with gravity so you can take a deeper breath. Then you need to use your pursed lip breathing. Breathe in through your nose, blow out through pursed lips. Make sure that your blowout is longer than your breathe in until you regain control of your breathing. Breathe in through your nose, Blow out through pursed lips. The chair is supporting my chest so I can breathe easier. You can also use the counter in your kitchen, or you can put your arms up against the wall when you're out in public, just to catch your breathing.
Patients with COPD expend a lot of energy doing just everyday activities. Educate your patients about energy conservation. For example, sitting down while doing activities such as grooming, keeping items within arm's reach or at waist level. It's important to avoid reaching above your head or bending below the waist. It's important to pace yourself, as well as to plan and prepare for activities.
If I start, I just stop and I just catch my breath and then I continue going, or like even the dishes. Sometimes if there's a lot of dishes, I'll, work it gets me to where I'm breathing, fast. So I'll just let the dishes air dry. I'll go sit down, watch Days of Our Lives. And then after that's done, I'll come back and I'll finish drying the dishes and put them away. And then I'm fine.
Step 6. Healthy living recommendations. Tips to follow to stay well and out of the hospital. These are ones that we've discussed previously. They include smoking cessation, treatment or management of anxiety and depression, healthy nutrition, and avoiding illness. Stopping smoking is still the best thing that a patient with COPD can do. It can help to relieve their symptoms, slow the progression of their disease, and extend their life expectancy. It's important that patients maintain a smoke-free environment. It includes avoiding secondhand smoke. Dyspnea can cause anxiety. Anxiety can make breathing even more difficult. Help patients become familiar with the anxiety-dyspnea cycle. Breathing techniques as well as anti-anxiety medications can be useful for some patients with anxiety and COPD.
Started to realize there were times that I couldn't function very effectively because I would get anxious. And I don't know, but I am kind of presuming that I'm not the only one who is in that position. The anxiety for me came because I couldn't breathe, which I never realized or thought of myself as a person who had real anxiety, but all of a sudden I did. But when you can't breathe, you have anxiety because you think, oh my God, am I ever going to breathe again? And you realize that you better do something about it. And there were several times that I ended up in the hospital for that reason. And I was not necessarily having an exacerbation. It was not necessarily the COPD that brought me into the hospital, but it was my anxiety. Remember your breathing and, smell the roses and, all the things that they teach you here. And so I started doing that. And every now and then I'd have to take a Xanax because it just really wasn't enough on my own. I needed the air. So, the air's coming at me, and I start my deep breathing and my exhaling, and that gets me through it.
Depression is common in patients with COPD. People who are feeling depressed are at higher risk for hospitalization as well as rehospitalization. Encourage your patient to seek help from their healthcare team if you suspect they are depressed. Patients with COPD and depression can benefit from antidepressants as well as from pulmonary rehab. If you suspect your patient with COPD is experiencing anxiety or depression, inform your patient's provider. Social work assessment may also be beneficial. Eating a healthy diet is important for patients with COPD. Nutrition counseling may be helpful for people with COPD to help manage either underweight or overweight issues. It may be easier for your patients to breathe when they make some changes in their diet, including eating smaller meals more often throughout the day, avoiding certain foods such as dairy products that can increase the amount of mucus or certain foods that produce gas. Also, it's important to stay at a healthy weight.
I try to eat well. You know, I think a healthy diet really helps a lot. I notice when I eat better, I feel better.
Eat smaller portions, eat several times a day rather than 3 big hefty meals. And I've found that, and also as I've gotten a little older, that I can't eat quite as much. But it's also true with the COPD, your stomach sort of, and your lungs and everything sort of expands, and you just can't take in as much food because you feel very full and uncomfortable.
Lastly, avoiding illness. Yearly influenza vaccinations and a pneumococcal vaccination are recommended. But other things that a patient can do is to keep their hands away from their face, wash their hands frequently, and stay away from others who are sick.
I always wash my hands. What do they say? Germophobic? I think I am. I think you get to be when you have COPD. I make sure I get all of my shots, my flu shots every year. I even get a pneumonia shot. Just try to stay healthy, eat right, be with family and friends, loved ones. That helps a lot. And then just have faith that everything is going to be all right. I have a very good faith.
Lastly, standardizing patient education is recommended. Patients receive care across multiple settings and care continuums. Each point of care is an educational opportunity. Consider forming a community team to coordinate care transitions. The more patients hear the same information, the more likely they will retain this knowledge. These 6 key recommendations, which include smoking cessation, symptom management and action planning, medication adherence, medical appointment adherence, exercise and activity, and healthy living recommendations, are all ways to help keep your patient with COPD healthy and out of the hospital.
I've never been in the hospital for my COPD, so I want to keep it that way, and I think maybe this is the way to do it.